Welcome to the Nursing Dojo with Sensei Klipoy. For today, we're going to be talking about MidCerts 4, and these are going to be the exam lessons and tutorials for you. There will be 51 questions. As a nurse, you are reinforcing teaching to a patient who is post-operative following abdominal surgery. You are teaching the patient about deep breathing and coughing exercises. Which of the following client statements should indicate to the nurse that client's understanding of the instructions? The answer is, I will splint the incision with a pillow to cuff. I will splint the incision with a pillow to cuff. As a nurse, collect data post-operative following abdominal surgery. Which data should nurse collect first? Should always be the vital signs, particularly blood pressure. The answer is checking the vital signs, particularly the blood pressure. As a nurse, you are delegating personal assistant 1 day post-operative abdominal surgery. Which of the following should nurse performs herself? The answer is abdominal dressing, assess it for drainage color and signs of infection. Abdominal dressing, assess it for drainage color and sign of infection. As a nurse, you are reinforcing pre-op teaching with client undergoing abdominal surgery, anti-embolic stacking after procedure. Client asks what stocking to do. What is nurse response? Improve circulation. Basically, the stocking, what it can do is to improve circulation. You are caring for client 6 days post-operative from abdominal surgery. Nurse observes evisceration after calling for help. Which of the following should nurse do first? Cover with wet sterile dressing. The answer is cover with wet sterile dressing. Nurse caring for client 3rd day post-operative abdominal surgery. You're assessing absence of bowel sounds, abdominal dissension, flatus. Client is experiencing which of the following complications? The answer is paralytic ileus. The answer is paralytic ileus. As a nurse, you are caring for a client who is learning he will need exploratory surgery next day. As a nurse, contributes to the prep teaching plan. Which of the following actions or teaching to take as a nurse? Reinforce information at the client's level of understanding. The answer is reinforce information at the client's level of understanding. As a nurse, you are caring for a client who is undergoing surgery the next day. The client tells the nurse, I'm afraid what's going to happen. Nurse response would be, the answer is, encourage the client to talk about his fears. Encourage the clients to talk about his fears. Obtaining informed consent from client prior to surgery. Necessary for consent to be valid, SATA. A disclosure of treatment is provided, voluntary consent, and understands procedure. Disclosure of treatment is provided, voluntary consent, and understands procedure. Review medical record of client following surgery. The history of anaphylaxis in response to penicillin. Prescribe cephalexin. Which of the following actions should a nurse take? Request surgeon to prescribe another antibiotic. Request surgeon to prescribe another antibiotic because cephalexin and penicillin is not going to work well. Caring client post-op, imagine herself on a beach and enjoying breeze. Non-pharmacologic pain management is called guided imagery. It's called guided imagery. Charge nurse is asked to witness surgical consent. Upon entering room, are there other options besides surgery? What should be nurse response? The answer will be several treatment or options are available for your disease. Have you discussed it with your doctor? Several treatment and options are available for your disease. Have you discussed it with your doctor? Collection of medical history. Taking herbal supplements scheduled for surgical procedure in 10 days. Nurse informs student which dietary supplements should increase the risk of bleeding. So feverfew will increase the risk of bleeding. Feverfew. Female client about to undergo knee arthroplasty. What action is the priority? The white blood cells, WBC, is the priority. Caring for a client who is using controlled analgesia. The nurse enters, finds the client asleep, finds the partner pressing the button to release the analgesic. What should the nurse do? Explain how the PCA works. Explain how the PCA works. Reinforcing teaching about pain control to a patient who has acute gastric pain. Which of the following indicates that the patient understands the teaching? Starts slowly and increase volume over several sessions. Start slowly and increase volume over several sessions. Nurse is caring for a client who is 2 days post-operative following abdominal surgery from full liquid diet. Which of the following is good for full liquid diet? The answer is chocolate pudding. Full liquid diet is chocolate pudding. You believe it or not. Nurse is reinforcing pre-op teaching to a client who is undergoing to an open abdominal surgeon. Which teaching is relevant or good? The answer will be compressions. The answer is compressions. Carrying a post-op client abdominal surgery who has clear diet. Which of the following and which should be in the diet? The answer will be cranberry juice. The answer is cranberry juice should be in the diet. Collecting a data post-op abdominal surgery, which of the following could indicate the cause of deep vein thrombosis? Deep vein thrombosis will be unilateral leg edema. Unilateral leg edema for deep vein thrombosis. Teaching about advanced directives who is scheduled for surgery, which of the following indicates further patient teaching? Children can make any changes in my living will if I am incapacitated. Children can make any changes in my living will if I am incapacitated. Nurses contributing into the plan of care of headaches due to spinal anesthetic surgery. What should the nurse do? Increase fluid intake to the release pressure. Increase fluid intake to release pressure. Reinforcing teaching to a client who has embolism stockings. What should the nurse include on patient teaching? It prevents venostasis. It prevents venostasis. Nurse is in urgent care preparing to remove the suture. Which of the following should the nurse do first? Cut the knot first. Cut the knot first. Cholecystostomy. Drainage from the dressing is thick. What does this describe? The answer is purulent. The answer is purulent. Post-op requesting something to drink. Which of the following actions should the nurse take place? Assess the abdominal sounds. She would like to drink, then assess the abdominal sounds. Caring for a post-op client, what should the nurse take to prevent infection control? What should the nurse take to prevent infection control? The answer is wash hands. Washing hands will prevent infection control. 2 days post-operative, patient with right hype was this. Patient states that following coughing, he feels pat in his tummy. The nurse finds out that there's a blood on the sheet. What should the nurse do? So there's blood on the sheet, cover wound with sterile gauze. Cover wound with sterile gauze. We got math here. At 330 hours, caring for post-operative client, having 120 ml per hour is the IV rate. How many ml is infused by 0600 hour? The answer is 300 ml. 300 ml is the answer. Post-operative client who has high risk of DVT. Which of the following should be included in plan of care? So frequent exercises, increase fluid intake, and measure the thigh. Frequent exercises, increase fluid intake, and measure the thigh. Post-op client, which of the following is a priority to report to the charge nurse? Should be the drastic change of blood pressure. If there's a drastic change of blood pressure, then let the nurse know right away. Nurse is reinforcing discharge instructions to a patient who has a kid that just had tonsillectomy, which indicates understanding of post-op care. Then you can have bleeding, which indicates understanding of post-op care is bleeding. Caring for a client who post-op when managing the client's pain. Which of the following? Managing the client's pain. Use a 0 to 10 scale to know the patient's pain and expect the client to verbally and non-verbally express his or her expression. So use 0 to 10 scale and expect the client to verbally and non-verbally express her expression. Reinforcing breathing exercises to post-op client. What should the nurse include? Sit in upright position and purse lips. Sit in upright position and purse lips. The following JCO